technology and the NHS is really behind the rest of the world probably, but certainly the rest of the private sector is absolutely, you cannot compare the two. And therefore there's a lot of inefficiency created in that.
Hi everybody, I'm Duncan Krieger. Welcome to DefenderCast. Finally, we get a chance to show you guys something slightly different. We are recording a podcast, both in sound and on video, and I'm incredibly excited to bring the next few guests to you. Please hold on to your seats and enjoy the ride. Just before I go, I don't get a chance to do this very often. Please make sure that you leave a little comment wherever you're watching or listening. Thumbs up would be really nice, and subscribe so that you are kept up to date with what we're up to. There is a mailing list which I will ask you to subscribe to for all tab things, and most importantly, don't forget to give me some feedback because I'd really appreciate it. Hello, welcome back. Today I had the opportunity to interview a GP, a general practitioner. She is currently working as a GP, having been to medical school, decided she wanted to be a surgeon, spent 2 years training to become a surgeon, then took some time out and decided to become a GP. And in the meantime, she's had this idea festering of starting her own business, which I think is fantastic. We got a chance to talk about culture today, talking about how to make people's lives better. And DefenderCast is about business, property and positive thinking, and this was something really different, but we touched on the business aspect and the positive thinking aspect from a really just different dimension. So hope you enjoy meeting Dr. Laura David. I don't think people really understand the scale of the size of the NHS, so I'm interested to understand a bit of insight from the inside, like what's it like to work for the largest employer on earth, or definitely up there in the top 2 or 3. I think they certainly have been at some point, because you touched on policy and procedure. Also, we had a conversation a week or 2 ago when we were talking about something that I just found impossible to fathom, about how much is still written on paper and faxes, which just baffles me. I didn't even know fax machines existed anymore. Literally, I wasn't sure if you could even buy one. What's it like to work for the NHS?
No fax machines at Tab then?
No, there aren't. I doubt there's one in the building.
It is an amazing experience, first and foremost, to be part of that, and knowing that what you're doing on a daily basis is hopefully helping people. It's also a really difficult experience because technology and the NHS is really behind the rest of the world probably, but certainly the rest of the private sector is absolutely, you cannot compare the two. And therefore there's a lot of inefficiency created in that. And that can be to do with communication, it can be to do with patient records, it can be due to writing patient records. So only recently in the hospital where I did my training have they moved to electronic records. So everything was written on paper, in a file, that, God forbid the hospital burnt down, that paper is gone and destroyed and nobody would ever have those patients' records. And, you were there flipping through the notes, writing on the next page, and not a lot of it was being done on electronically. And even in the beginning, I remember when I was a house officer, so this was in 2009, my first job, you couldn't even request an x-ray on the computer system. I had to go down with a piece of paper and take it into the radiology department, the x-ray department, and submit it on paper. And then, it just, all of these inefficiencies, you're not utilising people to their maximum capability, make it quite a difficult place to work. But creating change in that environment is so difficult because it's such a mass scale. So
difficult and obviously rewarding if you could do, but it's, I've heard people say that it's so big that it's harder to roll out. Obviously sitting here in my high chair, I'm saying, how could that possibly be possible? But it just feels like it's a kind of self-perpetuating problem, if you like, where until a line is drawn in the sand and things need to be done. In the world that we live in, it is so far advanced from electronic note taking. Theoretically, doctors will be like a microphone would be able to capture the conversation and record everything directly into a client's file, like there is so much that could be done.
Yeah.
So that just particularly...
I mean, it is interesting. So there's a lot of innovation going on in the NHS, and in particular in general practice, and some of that's done privately and then brought in by the NHS and it's been, the concept's been proven to be effective. I mean, you know, one thing that we've adopted now in general practice, and it's really, I think it's brilliant, and I think was maybe met with a bit of, it was quite sceptical in the beginning, because we're all very traditional in our approach, and change isn't always met that with open arms. But now we started text messaging patients. So this is something we have on our desktop. We're still using our PCs in practice. I've suddenly now got 2 screens on my desk, which is unbelievable. Has revolutionized my practice. But this text messaging system, and it was actually developed by one of my colleagues' husbands, it's really taken off, and you can text message any information to a patient, or let's say you've reviewed their blood test results and you want to text them some of the information, or let's say instead of me, now what I used to do was a patient would come and see me, I wanted to give them a leaflet or some information about the condition that we've just discussed, or a medicine that we've just started. So I would print it out and give it to them and staple it if I had time. And, you know, they'd take it home and they'd probably just chuck it in the bin. But now I can just text message them a link to the information. Like, you know, there's loads of things that can be done on text, and as long as they agree to be texted. And so that's really a big advantage that I see in my current practice. I
mean, I applaud it, because I think it's fantastic, but you know, a lot of businesses have been texting their clients without having to call them back and wait for them to make an appointment. The amount of time saved just in tiny small adjustments is amazing. But so you currently, let's just clear this up, so I'm not even sure I'm aware, currently GP in an NHS practice and private as well?
Not yet, but I will be. I'm going to be working privately soon.
So you've had some exposure to the different environments of NHS GP versus...
I'll probably be able to comment on that more in the next few months, but...
in the next episode,
thanks. Hopefully I'll come back. The NHS has been my predominant source of my experience so far, and so coming back to my sort of career changes, I eventually, I became a GP trainee, and then I had my first child. I eventually realised some sort of concept that I was interested in a different way of using my skill base and my knowledge base to give information and accurate information, because there is so much inaccurate information out there and so much anxiety that's created as a response from reviewing that information online. And that's
basically people searching on Google, I've got a thing on my finger, and then adding 2 up, getting to 22.
And a lot. So some of what we do in consultation is looking at sort of myth busting and looking at the evidence that people are bringing to you. I looked at this. I mean, one of the sort of staple phrases that patients do come in with is, well, I've looked it up on Google and I know I shouldn't have done that. And so they know, they're searching for the information. They want the information. They want the information to find that out themselves. So they're taking a proactive response to what their issue is. But they're not really able to come up with the right conclusions. And there are things out there that can help them. So just being aware of what the best websites are, for example, for those problems. And that's really specific. But, you know, we use the NHS website, NHS UK website a lot. Patient.co.uk can be helpful.
So one of the first things is like, where have you been? Where did you get this information
exactly.
from?
Or some occasionally, there's not so much anymore, but they used to bring like a newspaper clipping of something they found in a tabloid newspaper, and some of this, you know, some of that stuff is really important because it's really emotive and it's driving what people's anxieties are. So it's important to look at it on that level, but helping people to get the best information, depending on what the problem is and depending on if it's a child or if it's an adult. There's a new NHS app which I would say is really worth downloading, because it's also sort of a navigation tool that you can find out lots of NHS written content about different problems. But still, if you don't know what the problem is, you're just making lots of assumptions.
You can still get lost, and I guess that you're not going to be able to remove the need for being able to sit down with a doctor who's got a broad range of experience, and they can guide you, you know, if necessary, to a specialist in the right field that
if needs be. And there's lots being done actually in sort of consultation models in general practice, looking at online consultation, chats, and you know, sort of more WhatsApp type models, which there hasn't really been a major. The jury's not really out yet on that one, but there are a lot of online consultations going on now. Babylon is one of the big ones, so people are engaging with doctors in different scenarios. It's not always sit down face to face, which you know, I believe is the best model, but economically it's not always so feasible.
Yeah, I mean, I guess a small amount of change can have a big impact.